So before answering your question, what is first pass effect, right? So let me tell a few more points related to this graph, then I'll explain. Okay. So this point, okay, this is graph plotted between time and the drug concentration in plasma, right? So normally we don't estimate the amount of drug molecule in the blood. So we estimate the amount of drug molecule which is present in the plasma. That will give more accurate result comparing to checking it in the blood. So plasma is a small content of blood. So if you centrifuge the blood sample, so it will separate into two layer. Okay, that one layer is what is called as the plasma, kind of yellowish fluid, right? So the mode of administration for this drug molecule is oral drug molecule, right? So many times we discuss because the initial concentration is zero. So 2 points I just wanted to tell, right? So one is called as what is meant by C max, and another one is the T max. Okay, so this point is called as T max, which is not illustrated in the graph. You may note it down. This point is called as the T max. So can you guess what is T max?
Maybe the maximum concentration of drug molecule in plasma, sir.
You have to complete the answer. Yeah, that is closer to correctness. T max. I have labeled
Time.
some. Yeah, time is important, right? The time at which we have the maximum concentration. That is what is called as the T max. So what is this C max? C max is this one is what is called as C max. So can you now tell what is meant by C max from this? What is C max here?
Maximum concentration of drug molecule in plasma.
Yeah, at any time. Okay, so what's the maximum concentration that we can get out of that drug molecule for the given administered dose? That is what is called as a Cmax and Tmax. Very important for examination. So coming back to what is first pass effect. First pass effect is see normally if you take the drug molecule as intravenous intravascular administration, okay, IV administration, intravenous injection, then directly we keep the drug molecule on the systemic circulation. Okay, so we are directly keeping the drug molecule here. In case of intravascular administration, example is IV injection, right? Intravenous injection, right? But if you take oral drug molecule, the route of administration of oral drug molecule is completely different. We do not keep the drug molecule directly on the blood in case of oral administration. So the site of administration is the mouth. Along with water or some other fluid, we swallow the drug molecule. It reaches the stomach. So from stomach, the molecule should enter into the systemic circulation. So before reaching that, there is another circulation called as portal circulation. Okay. So from the gut, from the intestine, the drug molecule will be absorbed into the portal circulation. So through this portal circulation, the drug molecule reaches the first organ called as liver in our body. So the functioning of liver is very important, right? So if the person having poor functioning of liver, right, so he cannot survive for a long time. The reason is that one of the main site of detoxification in our body is taking place at liver. Liver is the major organ that participate in detoxification. So what is this detoxification? Any foreign element, if it enters into the body, like drug molecule or bacteria, virus, or any other pollutant, whatever it is, if they enter into the body, this liver it can recognize that, and the liver it can synthesize many enzyme that can destroy those foreign elements which enter into the body. This is not immune system, don't get confused, right? So this is a very normal thing, job of the liver. So it has many enzyme. The main function of those enzymes are like detoxification. They involved in detoxification mechanism. So the drug molecule will be considered as a foreign element. So some of the enzymes which are present. So very specifically, the liver will be having a kind of enzyme, family of enzyme called as cytochrome P450, generally called it as CYP450. It's called as cytochrome P450. So the main job of this family of enzyme is that they have to detoxify. So they detoxify the drug molecules. So because of the detoxification, uh, say this is the amount of drug molecule which enter into the liver, which reaches the liver through the portal circulation. Some quantity of the drug molecule will be metabolized with the help of this CYP P450 enzyme. The remaining molecule will enter into the systemic circulation and reaches the other part of the body. Okay, goes to the heart and pumped to the other part of the body, right? So for example, if 10 mg of the drug molecule reaches the liver, if 50 mg is the dose administered, right? So only 10 mg got absorbed into the portal circulation. Those 10 mg is subjected to liver. Say only 8 mg enter into the systemic circulation. The another 2 mg they are detoxified or metabolized by the liver. They cannot enter into the systemic circulation. Okay, so the amount of drug molecule that is metabolized before reaching the systemic circulation, that is what is called as the first pass effect. Is that understandable? And the major organ which involved in the first pass effect is the liver. Is that understandable? Am I connected?
Yes, sir.
Yes, sir.
Somebody asked this question to explain first pass effect.
Yes,
Is that
sir.
understandable, right?
Understood, sir.
So, but only one point you have to remember is that liver is not the only organ which can participate in first pass effect. Don't think that I am confusing you. Again, I repeat the concept. There may be some other mode of administration like oral administration. So, for example, if you take nasal inhaler, if some molecule is administered through nasal inhaler, we're not directly keeping the drug molecule on blood. The molecule should be absorbed. Okay, it should get entered into the circulation. Just like the absorption taking place in the intestine, stomach region. So for nasal, there should be some region there in the gastrointestinal tract where the absorption should take place. If you take 50, if you take say 1 mg of drug molecule through nasal spray, if only 5 mg enter into the circulation, if the remaining is metabolized before entering into the circulation, that is also assumed as first pass effect. Is that understandable? This first pass effect can be taken place anywhere in the body, but the major organ is the liver. Is that point understandable?
Yes, sir.
Yes, sir.
Yeah.
So
Okay.
I have a doubt, sir.
Yes.
Sir, if the drug molecule is administered for some pain or something, some disease, for the liver or part of the body before the liver, so what happens to the drug molecule, sir?
Can you say again?
Sir, if a drug molecule is administered for some kind of disease caused in the some kind of disease present in the liver or parts of the body before the liver,
Hmm.
so what happens to those drug molecules, sir?
No. Okay. That is, you mean that the disease is related to something outside the body, right?
No, sir. See, each drug molecule
No, no,
goes.
I understand your question. You understand my answer. I am giving the correct answer only. You understand my words, okay? So you are saying that the disease is not. You are saying there is some disease for which it is not necessary the drug molecule should enter into the circulation.
Uh, yes, sir.
Is that your question?
Yes, sir.
See,
Like
the disease
if
is
there,
related to liver. There is
yes,
some
sir.
liver disease. In that case, no issues. The bioavailability will not decrease.
Okay.
Okay, this first pass effect is related to bioavailability. You have to understand. We are making the connection between the dose administered, and the amount of drug which entered into the circulation through the concept called as absorption, where this first pass effect comes into picture. If you feel that your target is not, it is not necessary for the drug molecule to enter into the circulation, in that case no need to talk about bioavailability, because the drug target is not present, the drug molecule need not be enter into the circulation. Are you able to understand?
Yes, sir. So it doesn't undergo absorption, excretion, those
Not
processes.
necessary. See, some quantity will undergo, we cannot stop that. We cannot come up with a drug molecule which cannot be absorbed, or we cannot
Yes,
come up
sir.
with a drug molecule which can be fully absorbed. All the process will take place, we have to account for that. See, if you feel that it is not necessary for the drug molecule to enter into the circulation, and if your mode of administration is an oral drug molecule, then you have to think of the molecule to be present in its ionic state. Okay, if it is present in its ionic state, there are less chances for the molecule to get absorbed, because the molecules which are present in the molecular state alone can get absorbed. So in that way, you have to design your drug molecule. It's like tailoring the drug molecule based on what is our need.
Yes, sir.
You would understand.
Yes, sir.
Yeah, hope I have answered, right? So we move to the next process. Now I hope that we have very good idea about absorption. We have very good idea about permeation. We have good idea about what are the factors which affects the permeation, absorption, and what is bioavailability, and how the bioavailability is related to different mode of administration, and what is first pass effect, right? At least I hope that you know the terms related to all this, right? So as we said that there are four important parameters which are studied in pharmacokinetic. The first parameter is the absorption. The second parameter is the distribution. Okay. So absorption is, I just give the definition again for the absorption, the process by which the drug molecule enter into the circulation from the site of administration. The definition for bioavailability is the amount of drug molecule that is present in the systemic circulation. Very simple two definitions, right? So what is the distribution? So once if the drug molecule enter into the circulation, say this is the circulation, general circulation, and your drug molecules enter into the circulation, right? So I already told that what is the main job of this systemic circulation. So it goes to the heart, right? So the heart pump the blood molecule. All the blood molecules will be circulated throughout the body. All the different organs, tissues, cells, they receive the blood constantly. Why do they need blood? Because the blood which carries all the required nutrient, oxygen, everything, right? So the blood should be supplied to all part of the body. But if you think of rate of flow, that will different from one part to the another part. That's what we'll be seeing, right? So what is this distribution? Distribution is the process by which this drug molecules from the systemic circulation will be circulated to all other organs and tissues. That is what is called as the distribution. So can you tell that why this distribution process is important for the drug molecule? Why do we need this distribution? What will happen if there is no distribution process?
So only then the drug molecules can exhibit the therapeutic effect.
So only then the drug molecule can reach the target site. Okay, only if there is no distribution, the drug molecule cannot be taken to the place where there is a kind of infection or injury, whatever it is, right? Distribution is the process that takes the drug molecule throughout the body. The point to understand is that the molecule will not be specifically taken to the place where we have the disease or injury. The molecule will be freely allowed to go to all the organ of our body, which means that all the tissues and cells of our body, right? Diffusing into the interstitial fluid and cells from the circulation, that is what is called as the distribution process. Uh, so if you want to understand the concept of distribution, the very first thing what we have to understand is that what is the total body water and how this body water is um, present within the body, right? So if you take 60% of the body weight in an adult men, 60% body weight of adult men, and 50 to 55 percentage, okay, is account for the water. So which means that we are mainly made up of water. 60% of my body weight is accounted by the water content of my body. If I say I am 70 kg, right? So 60% of the 70 kg, that weight, from where it comes from? It comes from the water that is present within the body. For woman, it is 50 to 55 percentage, right? So as I said that for 70 kg men, the total water content used to be 42 liters. Now you have to think, right? 42 liters of water content is present in the body of 70 kg men, right? So we are mainly made up of water. This water is present, distributed in different compartments, right? So if we want to understand the distribution process clearly, we have to understand how this water is distributed in our body, right? So this is a very important image that shows that water content of different organs. Okay, so we said that 42 liter of water in 70 kg men, right? So not all present in the same organ. It's distributed in different organs. If we sum all, that's the quantity what I shown, 42 liter, right? So if you take brain, okay, most of the brain, 75% of the brain, right? So which is water content. If you take blood, 83% of blood is nothing but water. If you take liver, 68%, take kidney, 83%, if you take some adipose tissues, 10%, if you take muscle, 76%, if you take skin, 72%, if you take heart, 79%, if you take lungs, 79%, if you take spleen, 76%, if you take intestine, 75%, if you take skeletal bone, 22%, right? So this is how the water is distributed in different organ of our body, right? So you have to memorize the values for examination point. This is very important, right? So how this water is present as different compartments in our body. So there are 42 liter water, right? So how it is distributed? First, we can split this water compartment as plasma, interstitial volume, intracellular volume. Three major compartments, three major classification. Plasma compartment, interstitial volume. Interstitial is that the region that is present in between the cells, that is the interstitial volume. Then intracellular is the water that is present inside the cell. These are the three major compartments: plasma, interstitial, and intracellular. So if you sum all, which comes under 42 liter for 70 kg men, so this 42 liter uh, this intracellular, okay, so it account for 28 liters of water, and this extracellular volume that includes the plasma and the interstitial, those are considered as extracellular, that account for 14 liters of water. Again, this 14 liter of water, we have two compartment in it. One is called as interstitial. As I said, that the volume of water present in between the cells, that account for 10 liters. And plasma, so as I said, that the water content of the blood, that's the plasma, so which account for 4 liter. And if you sum all this, which comes 42 liter, right? So is that point understandable? The different water compartments in our body: plasma, interstitial, intracellular.
Yes, sir.
Okay. Okay, this is what I explained, right? So I just keep this. Are you clear about what is interstitial volume and intracellular?
Yes, sir.
Yes, if you take the tissue, right? So tight way in which the cells are, packed, that is what we call it as the tissue, right? So in between the cell, there may be some region, right? So that is what is called as the interstitial volume. These volumes are called as interstitial. So within the cell, okay, that is called as the intracellular volume. The same thing, right? So I just keep this. Uh, okay, this is very important for examination. Also, if you sit for any core company interviews, right? So they may trigger some question related to uh, the body compartments and how the drug molecule can be distributed in different compartments, water compartments of the body. So if you take any small water soluble drug molecules, any small water soluble drug molecules, or in general any small water soluble molecules like ethanol, right? So if you take ethanol, it's a very small water soluble molecule. So where we can find this ethanol? If you drink ethanol, where this ethanol can be found in our body, where we can find the ethanol? So the total body water. So wherever we have the water, okay, interstitial fuel, intracellular fluid, plasma, all compartments we can find if the drug molecule is a small water soluble molecule. So have larger water soluble molecule. I hope you people know what is meant by water soluble, right? So we emphasize water soluble. So which means those drug molecules which are having more polar functional group that enhances the water solubility. Example is gentamicin, right? It's antibiotic drug molecule. So if you look at the structure of gentamicin, okay, the molecular size of gentamicin is very large. It's a very big drug molecule, right? Larger drug molecule. But if you look at the various functional groups which are present in the gentamicin, most are polar functional group which will enhance the water solubility. So if the drug molecule is larger in size, water soluble, which compartment we can find this drug molecule during the distribution process? So we can find this type of molecules in the extracellular part. So can you tell why this type of molecules can be found only in extracellular water?
So because of its size, it can't go between cells.
Okay, one answer is because of the size. Another one is it is not having lipid solubility, so it cannot enter into the lipid cannot enter into the cell. It cannot reach the intracellular part, right? So if you have larger protein molecule like antibodies, most of the antibodies will be having larger in size, and the characteristics of those antibodies are they are basically protein in nature, right? So where we can find those drug molecule in plasma compartment of the body. So which means that they cannot enter into the interstitial or intracellular part because of its larger size, right? um, so if it is a highly lipid soluble molecule like diazepam, the fat tissues will absorb those molecules. And if it is certain ions, right? So fluoride like ion, those will be goes and absorbed or deposited in the bone. So this gives very brief idea, general idea about uh, no. If you see the structure of the drug molecule, to some extent, we can say whether the molecule will be present in the total body water, or whether it will be present the extracellular water, or whether it will present the plasma or fat or bone. Once if you know how to analyze the structure of the drug molecule, is it understandable?
Yes, sir.
Yeah. So just like the factors which affects the absorption, so we discussed about the size of the molecule, concentration gradient, vascularity. Uh, what are the parameter we discussed? Surface area, right? So these are the factors which mainly affects the permeation and the distribution, sorry, permeation and absorption, right? So similar to that, what are the factors which affects the distribution process? Again, once again, let me repeat what is meant by distribution. Distribution is the process by which the drug molecule that is present in the circulation will be taken and distributed to all the organ, tissues and cells of the body. What are the various factors which affects the distribution process, right? The first important property is the organ blood flow, right? So very important. The general point about organ blood flow, right? So we have the heart. Okay, so every moment the heart is pumping the blood, right? So the oxygenated blood, right? So which will be pumped to all the organ and tissues and cells of our body. But if you think of the rate of blood flow, the rate of blood flow is not constant throughout the body. Some region, some part of our body which receives the blood at a higher flow rate, and some organ, some tissue, some cells, they receive the blood at slower rate. That is called as the flow rate of flow of the blood, right? So what are the rapidly distributed or highly perfused tissues in our body? So if you take brain, heart, liver, kidney, so these are considered as very rapidly distributed and highly perfused tissues. So the rate of flow of blood to these organs like brain, heart, liver, kidney, it is very large. So can you now tell why the rate of flow of blood to some organ is very large, very fast, very rapid? Why it is rapid for brain, heart, liver, kidney?
So it is more important.
Because these are the organs which are very continuously, constantly, functioning, working, and its function is very important. Okay, you have to think that if the heart stop functioning for a minute, what will happen? If the brain stop functioning for few moments, what will happen, right? So these are very crucial organ. Okay, so that is why the rate of flow of blood to these organs are higher, right? So there are certain part of our body, they receive the blood slowly. So if the blood flow is slow, the distribution is will be slow. Okay, the drug molecules will be distributed slowly to the organs which are less perfused, tissues which are less perfused, right? So one example is the skeletal muscle, right? So if you take skeletal muscle, the distribution of the drug molecule will be slow to the skeletal muscle. The reason for that is these tissues are less perfused comparing to the brain, heart, liver, kidney. There are some other part of our body. The distribution of the molecules will be very very slow, which means that the blood flow will be very 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 slow. The examples like skin, bone, adipose tissue. So these are some part of our body which receives the blood flow at very slow rate. Hence, the rate of distribution to those regions, skin, bone, adipose tissue, will be very, very, very less. The distribution of drug will be very, very, very less. Is that understandable?
Yes.
So moving on further, right? The first factor which has impact on the distribution of the drug molecule is the rate of flow of blood, the rate at which the tissue is perfused. Okay, that determines the rate of distribution of the drug molecule to that organ or the part of the body, right? So what is the another factor, important factor which affects the rate of distribution? The second factor is called as the plasma protein binding. So again I repeat, so what is this plasma? So many times I said, so plasma is nothing but component of blood. Okay. So normally if you go to laboratory, right? So if they take blood sample, okay, normally we give the blood sample for some kind of analysis. If you have some infection, right, doctor may ask you to check what is the microorganism which causes, right? So they may ask you to give blood sample test, right? So if you centrifuge this, at certain RPM, right? So what will happen that, so this blood will be separated into two layers. Okay, so the top layer is the plasma, which will be yellow in color. It's a fluid component of the blood. Simple way to understand, right? So the beauty of this blood, right? So if you take blood, beauty of this blood is that it contains many different types of cells. We have red blood cell, right? So white blood cell, all are present in that circulation, right? So along with that, there may be many protein molecules which may be present. So let me draw like this. So assume this is the protein that is present in the blood. Along with the different types of cells, okay, some proteins also present in the blood. So some of the proteins you may already heard about, right, like albumin. Albumin is a kind of protein present in blood. Some lipoproteins are present in the blood. Glycoproteins, there, globulin, family of protein. These are the proteins which are commonly present in the blood, right? So what will happen, since these are protein molecule, right? So let me show, this is, assume that this is albumin protein molecule. So one of the important characteristic feature already what we discussed for protein is most of the protein molecules will be having some space for binding the drug molecule. And also we said that proteins are very good drug target. The reason for saying that proteins are good drug target is because they are druggable. They used to have some space for binding the incoming drug molecule. So the drug molecule can go and bind to the protein and it can modulate the structure and function of that protein molecule. Very basic thing. Very similar type of proteins can be present in the blood like albumin, lipoprotein. So now the drug molecule is present in the blood. So what this drug molecule may have affinity for the binding site of the protein which are present in the blood. So this drug molecule now can go and bind to the proteins which are present in the blood. Okay, so now we are going to differentiate the drug molecule in blood into two types. One is the free drug molecule. Another one is the bound drug molecule. So this is an example for bound drug molecule. These are example for free drug molecule. So free drug molecules are the one which are freely floating on the blood. Bound drug molecules are the one which bound to some of the proteins which are present in the blood. Is that point understandable?
Yes.
So very important point I am going to say that this free drug molecules are the active drug molecule and this bound drug molecules are inactive drug molecule. Don't get confused in terms of its activity, right? So again I repeat, this free drug molecules are active and the bound drug molecules are inactive. So once if the drug molecule bounded to the protein binding site of any protein present in the blood, then that drug molecule is not freely available for transferring to the cell, which is not available, which is unavailable. So that's why it is called as inactive drug, not active drug. The freely floating drug molecules, they are active. They can be sent to other cells and tissues. Is that point understandable? Bound and unbound. So how we call active and inactive drug molecules? Make sense? Looking for some response.
Yes.
Yes, right? Okay. So this is what I said, active, inactive, right? So the drug molecule, they bind to protein. Don't get confused with this protein. These are not drug targets. So these are just protein which are present in the blood. Again, I repeat, the drug molecule bind to proteins which are present in the blood. These are not the drug target. Drug target is different. Drug target is the protein that causes the disease for which the drug molecule is designed. Okay, so this drug molecule is having affinity for some other protein that is present in the blood. So it goes and bind to the blood protein. Okay, so the free drug molecule, so this is the free drug molecule which goes and bind to the protein. So before binding to the protein, it is free active form. So once if it bound to the protein, it makes complex, drug protein complex. So once if the drug molecule is bounded to the protein and in its complex state, then it is called as bound state or inactive state. So only the free unbound drug molecule can diffuse to the interstitial fluids and cell. That is what I exactly explained in my previous slide. Only the unbound drug molecule can diffuse to the interstitial fluid and then to the cell. So there is always equilibrium exists between this active free form of the drug molecule and the bound inactive form of the drug molecule. What it indicates that, so this complex is not permanent, it can dissociate. The reaction can go in backward direction. Again, we can get the active drug molecule, free drug molecule and the protein. Is that understandable?
So, what happens if a drug target is within the blood?
If the drug target is in blood itself,
Yes, sir.
all our discussions are relating to the drug target is present somewhere inside the cell.
Okay.
Okay, if your drug target is in blood, for that case also this concept are applicable. Okay, unless until if this protein is our drug target. I don't know whether you understand or not.
So, could you repeat it?
So we are saying that the blood is having many different types of protein. Okay, let us say these are the different types of protein. Your question is that what if my drug target is present in the blood? That's the question, right?
Yes, sir.
Say this is your drug target which is present in the blood. I'm saying that whatever I have explained so far is applicable if your drug molecule binds to any of this protein. If your
Yes,
drug
sir.
molecule binds directly to your drug target on the blood, then that is going to produce the desired biological effect. Is that point understandable?
Yes, sir.
So whatever I explained, that is applicable even if a drug target is present in the blood itself. Hope I answered right.
Yes, sir.
Yeah, moving on further. Any other question up to this so far? Any questions up to this? Anybody?
Sir, I have a question, sir.
Yeah.
Sir, is the small water soluble molecules go into intercellular space? Sir?
Your question is related to
Before,
this slide, right?
yes,
Am I right?
yes, sir.
Yeah, can you speak a little louder? I am sitting in some other place in which the voice is not clearly audible.
Sir, is the small water soluble molecules go into intercellular space?
It can go anywhere. Okay, total body water is no. This is the total body water. Okay, it can go to plasma. It can go to interstitial volume. It can go to
Still, it
intracellular
is
volume.
not lipid soluble, no, sir. Then how can it?
Okay, so we are not saying that it is completely water soluble. Okay, even if the size is very small, they can enter. There are different ways, different route for the drug molecule to enter. They can use the ion channels. Okay,
There is.
the small molecules will access. The larger molecule will enter through the ion channel. So during the process of that entry, since these molecules are very small, they can also get access, get enter into the cell.
There is.
Okay, so hope I answered right.
Yes, sir.
Here the small means very small. You have to think of the size of ethanol. It's very, very small. Okay, very small molecule, they can enter into the cell very easily. Even if they have lack of lipid solubility, they can easily enter.
Yes, sir.
Yeah. Any other questions? Okay, assume that no question. So this is the same concept which I explained theoretically, right? So here we have some kind of image for making it understand the concept clearly. So these are the various water compartments in our body. So the plasma compartment, interstitial water compartment, intracellular water compartment, fat, okay, transcellular water, right? So different compartments there, right? So I said that the drug molecule which is present in the blood, it can present in two forms. One is the free unbound form, active form. Another one is inactive bound form. So this is inactive bound form and this is free active form. The free active form can be distributed from one compartment to another compartment. Again, I repeat, the free active form of the drug molecule can be transferred from one compartment to the another compartment, but this bound inactive form cannot be transferred from one compartment to the another compartment. That is what is clearly illustrated in this image, right? So we have plasma compartment. So here this is called as a bound form of the drug molecule, and this is the free form. This is the free form of the drug molecule or active form of the drug molecule. This is the inactive form of the drug molecule or bound form of the drug molecule. Bound, here it is unbound. There are many words, right? So all refers to the same thing. No need to worry, right? So this free form of the drug molecule, it can transfer from one compartment to another compartment. It can move from plasma water compartment to interstitial. So it can move from interstitial water compartment to intracellular water compartment, interstitial to the fat compartment, and so on, right? The key point is that if the drug molecule is in its free form, it can move freely from one compartment to the another compartment. Unfortunately, if the drug molecule is in its inactive form, that is the bound form, complex form, it is complexed with some protein that is present in the blood. So if it is in bound form, this bound form cannot be transferred from one compartment to another compartment. Very important, the bound form cannot be transferred from one compartment to the another compartment. First point. Second point is, so this bound form or this active form of the drug molecule, it's not permanent. They have equilibrium, which means that this bound form, okay, the drug molecule bounded to the protein will be released and converted into free form at some time. That free form can be transferred from one compartment to another compartment. So if we summarize this, only one point, key point, that the free form of the drug molecule can be transferred from one compartment to another compartment. The bound form cannot be transferred from one compartment to another compartment. Second point is the bound form of the drug molecule and the free form of the drug molecule, they exist in equilibrium. The bound form will be dissociated into free drug molecule and protein. The free drug molecule and the free protein molecule associate back to form the complex. There is a equilibrium exists between those two processes, association and dissociation. Is that understandable?
Yes.
So can you now tell that why the bound form cannot be transferred from one compartment to another compartment? What's the reason? We are saying that the free molecule can be transferred. It can freely move from one compartment to another compartment. Why the bound drug molecule cannot be transferred? There is one simple answer, very simple logic answer. What do you think is the reason for the bound molecule cannot transfer from one compartment to another compartment? Is my question understandable?
So maybe due to the size of
Yes, absolutely right. So one and only reason is the size. So if it is a free, the molecule is having smaller size. If it bound to protein, okay, we have to consider the size of the drug molecule is even larger than the size of the protein molecule. That is the reason why it cannot be transferred from one compartment to the another compartment. Is that understandable?
yes.
Yes, right? Okay. So next is the molecular size. So molecular size are another factor which affect the rate of distribution of the drug molecule to various tissues and organs. So extremely larger molecule will prefer the plasma compartment. Okay, so extremely larger molecule, even if it is a lipid soluble, if the size of the molecule is very large, if it is extremely larger molecule, they will prefer to present in the plasma compartment itself. So coming to lipid solubility, so far we discussed the water compartment, water solubility, right? So coming to the lipid solubility, right? So we know that the presence of some functional group will enhance the lipid solubility. Uh, 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 you know, distribution specifically, especially to the brain, right? So which need lipid solubility. Very important point. The molecule, if it has to reach the brain, they should have very good lipid solubility. Okay, poor lipid soluble molecules cannot reach the brain. It cannot reach the brain, right? So the reason is that there is a kind of barrier in the brain called as blood brain barrier. It's called as blood brain barrier, BBB. So this blood brain barrier is a very tight junction. Okay, the cells, they adhere very tight way. It will not allow any molecule to easily enter into the brain unless until the molecule is having very good amount of lipid solubility, right? So that is the importance of lipid solubility for the distribution of the drug molecule to the brain. Very important question related to the examination, competitive examination, core company, anything, right? Later we'll see what should be the exact value for crossing the blood brain barrier for the drug molecule. Special type of barrier for distribution is called as two type of distribution. One is called as placental, another one is the blood brain. Blood brain, just now I told, right? So blood brain barrier will be permeable only to highly lipid soluble drug molecules with lower molecular weight. You have to remember this point. They should have very high lipid solubility with low molecular weight. Okay, that's the condition for crossing the blood brain barrier. Very high means not too high. Okay, some threshold value is there, we will discuss later, right? So another important special barrier for distribution, it's called as a placental distribution. So fetus to mother to fetus, right? So where comes the placental barrier? So during the pregnancy time, the mother may take some drug molecule. Basically, what we expect is that that should not affect the fetus, which fetal that should not affect the fetus, right? So most small molecular weight drug molecule cross the placental barrier. Okay. Uh, so this is a very important point, right? So not necessarily that the molecule should have lipid solubility. If the molecular weight is small, this is not related to lipid, please understand, right? So this blood brain barrier is related to lipid. So this placental barrier is not related to lipid. We are not talking about the lipids. General point is that any small molecule, small means very small, any small molecule, they can cross this placental barrier. So which means that if the mother takes any drug molecule which is having very smaller in size, the drug molecule will reach the fetus, the baby on the right. So that is the reason why during the pregnancy time, right? So the doctors will not recommend certain drug molecules because the doctors, they very well know that which molecules are smaller in size and which molecule should not be prescribed, because they know very well that which molecule can be transferred cross this placental barrier, transferred from the mother to the fetus, right? These are two special types of barriers, right?